The understanding of anatomical planes and body movements is foundational in biomechanics as it allows for the classification and analysis of human motion in a structured way. When we describe movements or positions of the human body, we often reference the three major anatomical planes: the sagittal plane, the frontal plane, and the transverse plane. These planes serve as an important tool for describing the direction and nature of movements, which are key for designing exercise programs that align with a specific sport or performance needs. The sagittal plane divides the body into left and right sections. Movements in this plane typically involve flexion and extension actions where the body moves forward or backward. A common example of a sagittal plane exercise is the standing barbell curl. In this movement, the arms flex and extend as the weight moves through an arc in front of the body. This is a basic representation of movement in the sagittal plane and serves as a clear example of how we analyze certain forms of strength training through this biomechanical lens. The frontal plane, on the other hand, divides the body into anterior, front, and posterior back sections. Movements in this plane often involve abduction and adduction, actions that move a limb away from or toward the body's midline. An example of an exercise in the frontal plane is the standing lateral dumbbell raise. This movement works by lifting the arms out to the side away from the body in a motion of abduction. The frontal plane is essential for analyzing lateral movements, which are critical in many sports that require side-to-side motions, such as tennis, soccer, or basketball. The third major plane is the transverse plane, which divides the body into upper, superior, and lower, inferior sections. This plane is where rotational movements occur, such as twisting the torso or rotating the limbs. A good example of a transverse plane exercise is the dumbbell fly, which involves the horizontal adduction and abduction of the arms. Here, the arms move horizontally in and out from the body while lying on a bench, engaging the chest muscles. Movements in the transverse plane are vital for sports that involve twisting and turning, such as golf, baseball, or martial arts, where rotation of the torso or hips plays a crucial role. In addition to understanding these planes, we apply biomechanical analysis to quantitatively or visually assess sports movements. While sophisticated equipment like motion capture technology or force plates can provide detailed data on how forces are produced and absorbed by the body, even basic visual observation can offer significant insights into how well an athlete moves. By comparing sport-specific movements to their biomechanical counterparts, strength and conditioning professionals can select exercises that mimic the required joint actions, enhancing the specificity of the training program. For instance, slow motion video analysis is often used to break down complex movements into their component parts, making it easier to design exercises that target specific joints or muscles. Movement patterns in the frontal, sagittal, and transverse planes serve as a basis for exercise prescription. Each plane of motion includes specific movements that can be targeted with resistance training exercises. For example, in the sagittal plane, movements like flexion, e.g. bicep curl, and extension, e.g. triceps extension, can be trained. In the frontal plane, exercises like lateral raises, abduction, and side lunges, adduction, can improve performance in lateral sports movements. Finally, in the transverse plane, exercises like Russian twists or cable rotations can strengthen muscles involved in rotational power, which is especially important for athletes in throwing or racket sports. It's also important to note that while most training programs target these primary planes of movement, some movements occur in between these planes or combine elements of multiple planes. These are referred to as multiplanar movements, and they are frequently found in sports where the body moves unpredictably or at different angles. For instance, running or sprinting requires forward motion, sagittal plane, lateral stability, frontal plane, and some degree of rotation, transverse plane, to maintain proper form and balance. Therefore, while training within specific planes is critical, incorporating exercises that challenge the body in multiple planes of movement is also essential for improving overall athletic performance and reducing the risk of injury. In biomechanics, we also focus on human strength and power, as these two factors are critical to performance in sport and exercise. Strength refers to the ability to exert force, while power is the ability to exert force at high speed. Although these terms are often used interchangeably, they describe different capabilities. For instance, while a weightlifter might demonstrate great strength during a squat or deadlift, an Olympic sprinter shows high power in their ability to generate force rapidly during their explosive starts. These differences highlight the need to tailor strength and conditioning programs to the specific demands of an athlete's sport. In conclusion, understanding anatomical planes and movement patterns is essential for the design of effective training programs. By analyzing exercises in terms of the primary planes of motion, coaches and trainers can ensure that athletes build the necessary strength, power, and mobility in all dimensions. Moreover, incorporating both single plane and multiplanar movements will help athletes perform better in their respective sports, as these exercises more closely mimic the complex multidirectional demands of real-world athletic performance.